Hello, and welcome to RT Quick Clip.
Patient shifts.
I'm your host, Adam, and today we're going to explore the different ways that
Patient shifts.
may affect you. Let's go get started. Shifts can occur in three planes: anterior to posterior, superior to inferior, or right to left. Looking at this AP digitally reconstructed radiograph, or DRR, we can visually see two planes of orientation anatomically. We have superior, and here we have inferior. On this side we have the patient's left, and on this side the patient's right. Looking at this right lateral DRR, we can again visualize two planes of orientation, albeit differing from the previous AP DRR. We have superior, and here we have inferior. On this side we have anterior, and on this side posterior. This is why an orthogonal set is desired. With angles that are 90 degrees apart, you can find your place in 3D space. Let's look at some shifts that may occur. Here is an AP DRR, and we have an open field of 10 by 10. Let's say I only have symmetric jaws, meaning that if I open up the width, both this side and this side will open the same amount. Let's say the doctor tells you to keep this inferior border, but to open up the superior border 2.0 cm. If we had asymmetric jaws, this would be very easy. We would simply open up this field border to 2 centimeters. When doing a simulation, you may not have this option. If you have symmetric jaws, then as we open up this border, the other border will open up too. But if we want to keep the lower border the same, this becomes a problem. So let's look at this on the DRR. If we open the field border by 2 centimeters, then this inferior border and superior border are each going to open up by 1 centimeter. Remember, we want to keep the inferior border constant. At this point, we've only made it 1 centimeter to where we want the upper border to be. In this case, if we shifted isocenter superiorly 1 centimeter, we will have moved the superior border 1 centimeter, and we will have moved the inferior border back to its original location. This is our original DRR, and this is our DRR with the field border open plus the shift. Let's see this on the machine. Here I've marked out a 10 by 10. We want to keep this border where it is, but open up the superior border by 2 centimeters. So I want to end up here. For my length, I'm going to open it up to 12 centimeters. Notice how the Y1 and the Y2 jaws, both of these, open up by 1 centimeter. If I want to keep this border where it is, all I have to do is move isocenter superiorly 1 centimeter. To make isocenter move superiorly, I have to move the table out. So I'm going to move the table out. We can see that I've kept my inferior border where it is, and I've properly opened up my superior border by 2 centimeters. This process is constantly occurring in a traditional simulation. The doctor will tell you what borders to keep. Then it will be your job to come up with the correct borders. If you have asymmetric jaws and your facility allows you to use them during a traditional simulation, this process is very easy. All you have to do is open that one jaw up. If, however, you're using the jaws in a symmetric fashion, it is not that bad once you understand how it works. What would you do if the doctor wants to open the lower border by 1 centimeter and the upper border by 2 centimeters? All you have to do is open the length 3.0 centimeters more. This then increases the upper border by 1.5 centimeters and the lower border by 1.5 centimeters. After completing the modification, move isocenter superiorly 0.5 centimeters. This will in turn move the upper border to 2 centimeters and the lower border to 1 centimeter. This of course can be done to the width as well, but instead of shifting superior-inferior, you would be shifting left and right. And of course, if you were on a lateral, you would be shifting anterior and posteriorly. To make these shifts, you can do a number of things. You could draw out the shift you want on the patient's skin, use the table numbers to make that perfect shift numerically, or you could just eye the shift using anatomical landmarks. You will come up with some circumstances where shifts will become necessary over a patient's treatment course. These shifts will occur when isocenter is not in the correct location. Generally speaking, the doctor will tell you where isocenter should be placed. You just need to shift accordingly. Here are some samples. Just keep in mind, this is assuming the patient is supine, head first towards the gantry. If the doctor wants isocenter to be moved here, a half a centimeter to the patient's left, then all we have to do is move the table 0.5 centimeters. Let's see how this is done. On this phantom, superior is located up here and inferior is located down here. I have put a piece of masking tape where central axis currently is. This, over here, is the patient's left. Looking at the table coordinates, I have a value of 1.3. If I move the table laterally 0.5 centimeters, I get a value of 0.8. Now, we come back, we look, and the shift was in fact moved, and it is also to the patient's left. I have verified that I have done the shift correctly. The shift is now complete. The doctor may also outline a box of where he wants the field to cover, perhaps something like this. Visually, it looks like he wants the field to be moved anteriorly 1 centimeter, so the table will have to be moved down vertically 1 centimeter. Let's go see how this looks on the machine. On this phantom, superior being located up here and inferior being located down here, I have put a piece of masking tape where central axis currently is. This is the patient's anterior, up here. Looking at the table coordinates, I have a value of 40.3. If I move that 1 centimeter, I get a value of 41.3. Now, when we look to verify that the shift was moved 1 centimeter anteriorly, you can see that it is located up here as opposed to down here where central axis used to be. The last and final shifts may come from a CT simulation. The CT uses a 3D coordinate system. Every center may have a different coordinate system, so check with your clinic. For our purposes, I will give the two most common types of coordinate systems. The first type of coordinate system is called the Varian IEC, and I've also heard it called the Varian Standard. This has X as left to right, Z as superior and inferior, and Y as anterior and posterior. This is a cube that shows this coordinate system. This is ant to post, or the Y coordinate. Anything positive means a shift to the posterior, and a negative number means a shift anterior. For the Z coordinate system, anything positive means a shift superiorly, and a negative value means a shift inferiorly. Last but not least, the X coordinate. Anything positive means towards the patient's left, and anything negative means towards the patient's right. So, if you have a value of X equals 1.2, Y equals negative 0.6, and Z equals 0.3, the shift would be 1.2 to the left, 0.6 anteriorly, and 0.3 superiorly. Keep in mind this is based on the fact that X equals 0, Y equals 0, and Z equals 0 is based on where the BBs are located. Please check with your clinic to see how shifts from CT are actually handled. The second type of coordinate system is called the IEC 1217. This has X as left to right, Y as superior and inferior, and Z as anterior to posterior. The main difference in the two coordinate systems is that Z is now ant to post, and Y is superior to inferior with the IEC 1217. Also, with the IEC 1217, the Z coordinate system has the anterior move as a positive value, while a posterior move will yield a negative one. This is a cube that shows the IEC 1217 coordinate system. Let's quickly look this over. This is ant to post, or the Z coordinate. Anything positive means that a shift is anterior, and a negative means a shift posterior. For the Y coordinate system, anything positive means a shift superiorly, and anything negative means a shift inferiorly. For the X coordinate, anything positive means towards the patient left, and anything negative means towards the patient right. So, if you have a value of X equals 1.2, Y equals negative 0.6, and Z equals 0.3, the shift would be 1.2 to the patient's left, 0.6 inferiorly, and 0.3 anteriorly. Keep in mind that this is based on the fact that X equals 0, Y equals 0, and Z equals 0 is based on where the BBs are located. Please check with your clinic to see how shifts are handled. Well, I hope you've enjoyed this quick movie on
Patient shifts.
Be sure to join me next time.